Hey, what's going on? Dr. Trevor Miner, physical therapist here. I've seen a lot of people lately who are transitioning from outpatient to home health. And if you're considering that move, this video is for you. Now, along those lines, I know that Medicare has planned 8% or 9% cuts to Medicare Part B services that would be provided in clinics. Under outpatient physical therapy. If this goes through, it would be absolutely devastating, not just for the patients who we serve, but also for physical therapists. So if you haven't done so yet, please consider contacting your legislators and encouraging them to support an amendment that withholds or stops this cut to outpatient physical therapy services. Having said that, if you're new here, please consider liking this video, subscribing to the channel. It would mean a lot. And with that said, let's jump into the top 5 pros and cons as for working as a home health physical therapist. All right, pro number one. Pro number one for me is the flexibility of scheduling. So what I mean by that is whether you want to start your day at 7 as far as seeing patients, or you want to start at 10, you can do whatever you'd like. So a lot of people have kids or responsibilities to do in the morning, and home health works great with that because you can just delay when you leave to go see your patients. Also, if you happen to have an appointment or say a store you want to visit during the day, you can go ahead and do that as well. Just schedule it into your day. Pro number 2, one of the things I love about working as a home health physical therapist is that I'm not pigeonholed into treating just one very specific diagnosis. So in other words, when you get a patient in home health, most typically it's going to come from a hospital or a skilled nursing facility. And when you see that patient, you're allowed to evaluate and come up with a plan of care that addresses whatever concerns the patient has or that you find. So oftentimes you could be treating multiple areas of the body or addressing multiple things. And as long as your plan of care gets signed, you can go ahead and treat the patient just like you feel they need. Okay, along those lines, pro number 3 is that you get to work with a wide variety of diagnoses in home health. So you may see somebody status post total hip, or you may be working with someone that just had a traumatic brain injury, or maybe had a heart valve fixed. But you get to work with a very diverse group of people, and I think that's great to keep your skills fine-tuned in a lot of areas. All right, pro number 4. Now, this is a big one. Because you're working in one person's home, you are, of course, working one-on-one with a patient. And you will find very few PTs who prefer to work with more than one patient at a time. So working one-on-one is a huge pro for working in home health. All right, pro number 5. Now this is a big one, and it often brings in a lot of people into home health. If it's the only reason you're getting into home health, you might want to consider all the different factors, but it's certainly not a bad reason to at least get started. Pro number 5 is higher pay, and we're talking quite a bit higher than most other settings. So in home health, if you're to get hired right now, you should expect a salary in the range of about $90,000 to $110,000 a year. You really shouldn't be below that, and you can definitely earn more than that if you have the time and the drive to go and see more patients. So salary is a big selling point for home health. Okay, now with the cons. Okay, so con number 1 for me would be that you're pretty much always on call. By that, what I mean is it could be 6, 7, 8 p.m. on a weekday. It could be a weekend on a Sunday morning. And if something comes through from someone you work with or in regards to a patient, you're expected to respond and address those concerns. So that's something that's a little different from other settings. You really are always working to some extent in that you're available and completing tasks as necessary. All right, con number 2. Unless you're in a big city where public transportation is your primary way to get around, you're going to be putting a lot of mileage on your car. So within my first couple years of working, I was putting about 35,000 miles a year on my vehicle. And needless to say, cars don't last long when you're putting 35,000 miles a year on them. So there are situations where your company may provide a company vehicle, and depending on what the terms are, that might be great. But for most people, you're going to be driving your own vehicle, which will make it not last nearly as long as it would otherwise. Con number 3. Now, this is one that most people hear about, but don't fully understand the extent of. In home health, there is excessive documentation, in particular for evaluations, discharges, but more specifically, OASIS starts of care and OASIS discharges, and then all of the other documents that you're expected to complete on the side and communication you're supposed to do on the side. All of that adds up to be just a lot of work. It's really quite a bit of work compared to, say, outpatient. All right, con number 4. For this one, if you're working in outpatient, typically somebody hurts themselves or has some insidious onset pain of some sort, and they want help, so they come and see you. What's different in home health is that most of the time, the patient didn't ask to see you. They were kind of assigned your service. In fact, a lot of times, or sometimes, they may not even know that you were even going to come to see them. They'll wonder why they're getting physical therapy to begin with. So unlike outpatient physical therapy, you really have to sell yourself and your services and explain what you do and how you can benefit them. So that's a big difference and can be certainly be a con of working in home health. All right, con number 5. For this, some agencies, a lot of agencies around the country have moved to a model where physical therapists are performing just evaluations, starts of care, supervision visits, and discharges. So you're not doing a lot of the in-between visits. So if that's the case, then you're going to be supervising one or more PTAs and doing most of those big, heavy documentation visits and fewer of those simple treatment visits where you're just working with the patient to treat their condition. So that would be con number 5. So those are my 5 pros, 5 cons for working as a home health physical therapist. I hope if you are considering this change that you find this information helpful. Having put all this out, I do love working in home health with the pros and the cons. And thanks for watching the video today, and I'll talk to you guys in the next one.